I was hoping to get you to kind of elaborate a bit more about the concerns about the variant strains possibly being more resistant to the vaccines, and why that might be the reason why we need to ramp up the delivery of second doses.
Yeah, so the delivery of second doses is really to try and get the best protection to as many people as possible. And the variants, the people who are infected with variants is only one aspect of that. It's not what's driving these decisions. I think we need to be really careful to not think about variants as some sort of separate entity. It really is about people and people who've been infected with different strains of this virus that have certain properties that make them, right now, one of the biggest things we're seeing is that the strains of the virus that seem to be doing better and spreading better are the ones that are more easily transmissible between people. So that's the B117 and the P1 that we're seeing. And that's what we would expect to see. This virus changes every time it replicates. And when you have a whole lot of people getting sick, it's replicating a lot. And that's why we see a whole bunch of new strains arising in India, in Brazil, where the virus really is multiplying so quickly between people. But the same things that we do to stop transmission work for people who are infected, no matter what strain that you have. And we see that in what we've seen in Whistler, for example, where we know that immunization programs, the program we had to identify and test and find people who were sick with this virus to isolate them, the outbreak control measures that we've taken made a difference, and we've now seen case rates plummet. And that was mostly people who were transmitting and infected with a variant that's P1. So it's not the variant that makes the difference. It's what we are trying to do to reduce transmission. And so far, we've seen that vaccination has been very effective in doing that. So when we see people who have been immunized, who become sick, we prioritize those to make sure that we're not seeing breakthrough more often with one strain of the virus than another. So that's how we're using our whole genome sequencing right now to make sure that we can detect and test anybody who's had a breakthrough case. And we've had about I think there were, last I saw, about 1,700 cases in people who have been immunized with either 1 or 2 doses of vaccine. Mostly 1 dose, and after 2 weeks. We know that it takes much longer than that, so that's an overestimate. So we are focusing on making sure we can see if there are transmissions that are leading to the vaccine being less effective. So far, we've not seen that, but we need to continue to monitor that, and that's why it's so important to get that first dose into enough people that we can get that transmission rates down so that we're not seeing more and more different variations increasing. And of course, part of that is reducing the introductions of new strains of the virus into the country, and where things like travel from countries where there's a lot of transmission happening, or from provinces or places where there's a lot of transmission. And that's one of the reasons why we've put in those travel restrictions we have here in the province, so that we don't have people going from areas where there's a lot of transmission and taking a virus to an area where there's not. So this is how we're attacking it, if you will, or getting attacking the virus here in this province, and that's about using immunization as part of our outbreak control measures, getting all of communities as much as we can immunized, and that's why we're putting the efforts right now on increasing vaccination rates across the Lower Mainland and getting those transmission rates down. That's our best protection to get through this next period, and then we boost everybody's immunization or boost everybody's protection with the second dose.